All right, for those of you just joining us, we're just going to give folks till 1:03 and then we're going to go ahead and get started. It is 1:03. Aaron, can you go ahead and start recording and we will jump right in.
Already recording.
Oh, wow. I've been sitting here saying hi to everybody, getting recorded.
Okay, I'll cut you out later.
Perfect. All right, everybody. Well, thanks for joining. This is an information session on the county's newest homelessness prevention initiative called Keep People Housed. You will often hear providers refer to this as KPH. Just as we do with other programs, we have I don't know the word that I'm looking for, but KPH is Keep People Housed. And thank you again for joining us. So this program is new for the county. It covers all of Sonoma County, regardless of where someone lives. They can apply for this program as soon as the application opens in December. So thank you for joining us. We've got several of our partners here. Thank you, Aaron, for changing the slide. COTS is the lead service provider for this program. That means COTS is responsible for ensuring that the program is launched successfully. And we are also responsible for making sure that all of the payments for which households are approved are sent out timely. We've got several sub-grantees within this grant providing services for all of the core regions within the county. Reach for Home covers North County. CSN provides services for Central, the Santa Rosa area. West County Community Services is covering West County. Home First is covering Sonoma Valley. COTS will be covering South County, and then Legal Aid of Sonoma County will be the provider of legal services for all households in the county who are referred for legal services under this program. So for those of you who work for one of those organizations, thank you for joining us. And COTS is really thrilled and humbled to be selected as the lead service provider for this program. Next slide. All right, this program is a private-public partnership funded by the County of Sonoma, the City of Santa Rosa, the City of Petaluma, and All Home. And for those of you who are not familiar with All Home is a nonprofit located in the East Bay, and they are a big funding partner for this program, offering 2.6 of the total 3.9 million funding to launch this program. And this is a 2-year program starting October 1st, 2024 through the end of September in 2026. And we will get into more detail throughout this presentation about when households can actually start applying for assistance. Next slide. This program is not just offered here in Sonoma County, and while Sonoma County is just now launching this program, we have learned best practices from other providers who have successfully launched and maintained this exact program in other Bay Area counties. So Alameda County and Contra Costa County are both good examples of that. Both of those counties have served thousands of households using this exact same program. It's also called Keep People Housed for those counties, and you can learn more and see applications for those counties at keeppeoplehoused.org. When you log into keeppeoplehoused.org, you'll also see a button that says Sonoma County coming soon. That is where all households will go to apply for assistance within this program. Next slide. All right, so KPH offers flexible assistance. One of the main points of this program is to be flexible in our approach to ensuring households that receive assistance maintain stability in their housing. So KPH is a short-term assistance program. This is not a long-term assistance program. So this will not take place of things like rapid rehousing or vouchers here in the county. This is short-term assistance, 1 month, 2 months, 3 months, depending on the needs of each individual and unique household that's applying. Some types of assistance that you might see would be rental assistance, deposit assistance, utility assistance, things like vehicle and transportation assistance, emergency assistance for things like groceries for a household, and even medical bill assistance. One question we got in the last one of these information sessions was whether this program would be able to offer assistance with the purchase of a vehicle. And the answer to that is no. But what we can do is if a household is able to demonstrate to us and they qualify based on threshold scoring and basic eligibility, that they need transportation to be able to stabilize income and stabilize their housing, that they can use what they would have spent on rent to help that family or household purchase a car, so that these funds are not being used to support capital kind of long-term purchases. And instead we're utilizing this program to jump in and provide that critical assistance kind of in the moment, the short-term assistance to stabilize that housing. An important note on this program is that it's really, really flexible to meet the needs of each household that's applying. So what we're looking at is the type of assistance the household applying for, is that reasonably related to the stability and sustainability of their housing? So it could look like mortgage assistance, again, rental assistance. For families and individuals who are looking for deposit assistance, the rule under this program, because we don't do housing navigation, would be that that household will have had to already locate and qualify for that housing and just need that deposit assistance to get into housing. So in that way, it is different than something you might see like rapid rehousing that we're a little bit more used to. Next slide. Thank you. And I also should have said this at the beginning, but anybody who has questions throughout this presentation, feel free to put them into the chat, and we'll reserve time at the end of the end of this presentation to answer all of those questions. The goal for this program during the 2-year pilot period is to serve 350 to 400 households. That kind of works out to roughly $6,000 per household if every household were to spend the average amount. But we do really want to let folks know that, again, it's unique to every household that's applying who qualifies and passes the threshold score. So it's not a $6,000 cap, and it's not a $6,000 minimum. We're not setting aside a specific amount for each individual household. That's just an average based on the funding available for the 2-year pilot period. Next slide. All right. There's a number of ways in which we will measure success in this program. The primary goal of this program is housing stability. So we will be following households that receive assistance for 6 months, 12 months, and 24 months to ask them, after receiving assistance from this program, do you still have your housing? Are you still stably housed? Was this program helpful, and how can this program be better? So all of the partners that are involved in this specific pilot program, we'll be submitting monthly data over to COTS, and COTS will report that data out not just to the funders, but also to other cities within the county, so that we can demonstrate the effectiveness of this program long-term, so that this program can be extended beyond the 2-year pilot period. So thank you again to providers who are on this call, and thank you, for submitting accurate and timely data, because that will be really, really important to demonstrate impact throughout the community. Next slide. All right, so a lot of us here, if you're on this call, you're probably already relatively familiar with this industry, which is, we're talking about affordable housing, low income housing, things like homelessness prevention and homelessness services. And one of the things that we often hear is that prevention is a lot cheaper than housing a family or an individual who has already fallen into homelessness. And that's true. Homelessness prevention is a lot more efficient in terms of how much we're spending versus helping an individual or a household who is already, living in their car, living on the streets. They've already gone through that eviction process. So this program is really meant to demonstrate cost efficiency and ask, cities and donors and community members to recognize the importance of prevention services as it relates to limiting the number of individuals and households entering homelessness, not just in Sonoma County, but as kind of a regional model. We also see vastly improved health and well-being for individuals and households who are able to either self-resolve or resolve through the assistance of a program like this and maintain their housing. Once somebody falls into homelessness, we start to see a big decrease in their health and wellness. So we are trying to avoid that as well. And then social and community stability. I think all of us can agree, I would hope that all of us can agree, that a community with fewer unsheltered members and fewer unsheltered neighbors is a much healthier community. And the goal of this program is to make sure that, throughout the 2-year pilot period, 350 to 400 households are going to be prevented from entering homelessness in a very cost-efficient, cost-effective way. Next slide. So how you can help. If you are on this call, one thing that we would ask is that as you're working with your patients, you're working with your clients, you're talking to members of the community, business owners, landlords, refer people to us for assistance. Now, not everybody who applies is going to qualify, and we'll talk a little bit more about risk factors and how folks can qualify. But the more people who are referred to this program and understand the benefits of this program, the better off the community is going to be. We want people to recognize that this is a critical component of the homelessness system in Sonoma County, and we want those folks to call us and talk to us about what assistance might they be eligible for? How does this program work? How can my business support this effort? You can also donate to any one of the organizations that is working on this KPH program. They will be listed in a future slide. You can donate to any of those organizations and indicate that you want your donation to be used as part of a prevention strategy. Next slide. So all of these slides will be sent out to all of you following this presentation. All of the providers for this program are listed here. Again, COTS is the lead agency on this, but if you are a provider or an individual living in one of the various regions, you can find the provider for that region here. Again, Home First is Sonoma Valley. CSN is Santa Rosa or Central Sonoma County. Reach for Home is North County. WCCS or West County Community Services is West County. And then Legal Aid is responsible for the provision of legal services for the entire county. Next slide. All right, so thank you for coming. I did want to talk a little bit about the application itself. When we finish this presentation, as part of what goes out to all the folks who registered, you'll get this slide deck, and you'll also get information on how individuals and families can apply to receive assistance. And that is through keeppeoplehoused.org. That application will open on December 16th of this year. If you go to that website now, all you're going to see is Sonoma County coming soon. That link will be live and open for applicants on December 16th. So when you are talking to community members about this program, please help them understand that applications open December 16th. There is no financial assistance available until that application cycle actually opens. We are happy to take phone calls and emails if folks have questions about the program, about how it works, what they can apply for, whether they might be eligible. We're happy to field those questions, but we simply cannot help anyone or issue any financial assistance until the actual applications themselves are live on December 16th. When families and individuals do apply, there's a series of questions. There's some basic eligibility questions. Basic eligibility means the household must live in Sonoma County. So if they're applying for rental assistance outside of Sonoma County, they will not be eligible. They must be 50 at or below 50% area median income. I'm struggling for the third one because I don't have the deck in front of me. Erin, do you have that slide? Or not, it's not a slide, but the handout.
I'll pull the handout out. I'll pull that out.
All right, perfect. Thank you. So once families and households meet those basic eligibility criteria, they will go through the rest of the application, and the application will evaluate other risk factors. And those risk factors will be listed, or a number of those risk factors will be listed on a handout that you'll get as an attendee here or a registrant here. But some of them are things like zip code, whether the household has a history of homelessness, and the third criteria just came to me for the basic eligibility, which is they must have experienced a recent financial hardship. Now, there is no concrete definition for recent. It could be within the last 3 months, could be the last 2 weeks, it could be the last 6 months, but they must have experienced some type of recent financial hardship to qualify for this program. The application should take anywhere between 20 and 30 minutes for any household who is applying for assistance. And if a household does need assistance, they can contact the subregional provider for whichever city or community that they're living in Sonoma County for assistance. And that assistance can either be provided over the phone or in person at a place, where the applicant feels comfortable. So maybe it's a library or a coffee shop, or maybe it is the actual office for the subregional provider responsible for that region. Once the applications come in, we will evaluate those applications based on a threshold score. So every application must meet basic eligibility criteria and then meet or exceed the set threshold score. And that threshold score is meant to, like many of us are used to with coordinated entry, set a prioritization. So this program, we don't have enough funding to serve every single household who meets basic eligibility. So we will be looking at households who meet or exceed the set threshold score so that we are serving the highest priority, highest risk households in our community and helping them stabilize first. Throughout this program, we may increase or decrease that threshold score depending on how quickly we're spending funds. And that's something as the lead agency we'll be looking at consistently, both with the funders and with other providers to make sure that, we are doing our due diligence and spending money in the most efficient and effective ways to best serve this community. I am happy to take questions. I know there's a lot of kind of high level information. If anybody has any more more in-depth questions or questions about details, we are happy to take those. And Erin, I'll have you read anything that comes through in the chat. And then if anybody else has questions, feel free to just raise your hand.
So the first question we have in the chat is, will this program assist clients with car repairs or registration?
So yes, so long as those car repairs and registration are reasonably related to stabilizing that household's housing, then yes, this program can be used to pay for things like that, so long as they qualify.
And then the second question, can KPH funds be used for deposits for clients who currently live in Sonoma County but find residence in another county?
You know what? That's a great question. I don't know that we've covered that yet with All Home. So All Home, again, is the Bay Area funder who is funding the financial assistance portion of this program. And I will ask that question, and then we can do a follow-up with registrants from this info session, because I don't want to say yes and then be wrong about that. So let's follow up. Thank you for that question.
Great. And then next question is being elderly or disabled considered a risk factor?
Yes. And there are, gosh, I want to say close to 20 risk factors. So no one risk factor is going to, put somebody over or under that threshold. There are many, many risk factors that we ask about, but those are both risk factors, yes.
For help with cars, does the car need to meet any requirements such as being insured?
Also a great question. We will suggest that folks who are applying for assistance for use on registration or vehicle repairs, we will certainly suggest that they are insured, but we are not going to mandate that their vehicle be insured to be able to receive that assistance if that assistance is reasonably related to the sustainability and stability of their housing. Any other questions?
Yeah, that's it for the chat for now, but please feel free to add your questions to the chat or to raise your hand.
And all of you may be seeing around town some flyers and posters. You might see a sign on the side of 101 that talks about KPH, or Keep People Housed, that we're here talking about now. And we are already fielding quite a few questions, so please continue to refer folks to us. We will start to process applications starting December 16th. There's a lot of folks involved in the implementation and training on this program, and we're really, really excited about it. This will be kind of the first of its kind of something so flexible flexible and something that is kind of a private-public partnership. And we will have data that comes out as part of the COTS newsletter. So if you're not signed up for that newsletter, feel free to sign up. You can do that on our website. And then, of course, that data, more in-depth versions of that data will be released out to, cities and communities here to encourage more than the 2-year pilot period for this program.
Great. We had a couple of questions that popped up.
Sure.
What is the turnaround time from time of request to providing assistance?
Great question. We do have a lot of households who come to us who are in a real time crunch. Maybe they've received a 3-day eviction notice. And what we will do is we will do our best to work with those landlords so that we don't have to cut a check the same day, because there are certain documentation requirements that we do need before we can send out that type of financial assistance. Generally speaking, we look at 4 or 5 days from the time a request is approved to the time a check is sent out. But we do have processes and procedures in place, both COTS and other providers, for cutting a check sooner than that if absolutely necessary.
And then another question, is there help available for veterinary costs or food for ESA or service dogs?
Really good question. I think, again, that goes back to, is that reasonably related to, the sustainability and stability of the household? So if that can be tied to, if I get this paid for, then my housing will be stabilized, then we could certainly look at providing that type of assistance. I would not take it off the table. We'll give folks just another minute here to ask any other questions that they might have.
Yeah, and there's, does the program assist with home furnishings?
I assume that question is related to, but Jennifer, please let me know if it's not, to households who are utilizing this program to pay a deposit for new housing. We would probably refer the household out to other agencies to assist with that type of thing, because this is really short-term assistance. It's not meant for kind of those longer-term expenses that people hold on to for a long time. Now, if there is a household and maybe one or more members of the household for something happened and somebody now has a severely disabling condition and they need assistance with some type of furnishing to help them maintain their housing because of that disabling condition, then this program could help with something like that. But for those households that are just moving in somewhere new, we would work with other providers in the area that are more focused on providing things like home furnishings for somebody moving into housing. Hopefully that helps, but Jennifer, feel free to clarify if I missed something on that.
Could this program possibly pay for a deep cleaning in order to help a client pass housing inspection?
Ooh, Nadia, I love that question. So this question has come up a couple of times, not specifically like that. But if a household, maybe they need help addressing a maintenance issue in their current housing and they're getting notices because of that maintenance issue and they don't have the resources to be able to rectify it, yes, this program is flexible enough to help households address that, again, if it's reasonably related to the stability of their housing.
And then Nora asked, can clients without immigration status be served?
Absolutely. We will not ask anybody's immigration status as part of this application. I keep saying, well, I guess I've said a couple times. Yes, you're welcome. We'll give everybody just another minute or two here to ask any questions they might have, and then we will stop the recording and get this sent out along with some additional information to those folks who registered. But make sure when you do get this slide deck, if you need to contact us, there is a slide in here with the contact information for all of the providers. So if you have any follow-up questions that maybe you didn't think of during this presentation, feel free to reach out anytime. We're happy to provide, clarifying information or refer you to someone who might be able to do that. Any other questions?
I think it's very similar to the previous question about, can you assist with house cleanup to preserve housing in cases of lease violations, inspection failures, etc.?
Yeah, very good question. Yes, if somebody keeps getting lease violations again because of some, maintenance issue, or maybe there's a situation with hoarding, and that is jeopardizing their housing, and they don't have the resources to be able to correct that issue for whatever reason, this program, if they qualify based on risk factors and, basic eligibility, can assist with those types of things.
And then on the same line, does the program help with removing items from the home due to hoarding?
Yeah, I think that goes along with the previous question there, that, we won't have providers from this specific program coming in to address that hoarding. But if there is kind of a cleanup crew and, they otherwise meet eligibility threshold score and it's reasonably related to their housing stability, then yes, this program would be able to offer assistance with that kind of thing. All right, I'm not seeing any other questions come through. But again, there's contact information in this slide deck that will go out. So if you do have questions, please feel free to ask. And throughout this pilot program, if you are working with somebody, they've had a good experience, they've had a bad experience, we welcome you to share that with us. We are working with other providers in Contra Costa County who have successfully launched and maintained this program for a number of years. So we're learning best practices from them. But if any of you see anything out in the community that this program could do better, or something that this program is doing really, really well, please share that with us so that we can incorporate change as necessary kind of throughout the pilot period. All right. No other questions coming through. Thank you so much, everybody, for coming, and please be on the lookout from Erin's team for a follow-up email after attending this information session. It was good to see everybody.
All right, thank you all. Have a great day.
Thank you.
It'll only be about 10 or 15 minutes. So, well, it's a little bit longer than that.